Hey guys, it's Dr. Hub. Today we look at the deceleration patterns on the cardiotocography. In short, it is also known as the CTG. So firstly, in terms of the early deceleration, what are we seeing? So let's represent it so it's easier to understand. So in terms of the early deceleration, what we are seeing is it is seen in terms of the head compression. So in terms of the head compression, this early deceleration will be seen. Next, we have the late deceleration. So in the late deceleration, what do we have? So in terms of the late deceleration, there is seen in the uteroplacental insufficiency. So this is seen in terms of the uteroplacental. So it is seen in terms of the uteroplacental insufficiency as well as the fetal hypoxia. So it is seen in the uteroplacental insufficiency as well as the fetal hypoxia. So you can represent it like this if there is a late deceleration phase. Next, we are looking at the variable deceleration. So in terms of the variable deceleration, as the name suggests, it is variable. So this is seen in terms of the umbilical cord compression. So it is seen in terms of the umbilical cord compression.